Today we have a very interesting guest for our podcast, mentor and trainer for many optometrists all over India. What should a student take based on your experience? Should they go for diploma or should they go for a bachelor's?
After 2020, the medical universities have also started phasing out the diploma programs.
We would like to touch upon all these points today. Hello everyone, I welcome you all to the podcast. Today we have a very interesting guest for our podcast, and she is also associated with Academy of Vision Sciences, Dr. Anuja Singh. Madam is a very senior optometrist and she has been in the field of optometry for the last 3 decades and has been mentor and trainer for many optometrists all over India. She is now heading the Academy of Vision Sciences, and today we'll be talking in general about the optometry scenario in India, the need for optometrists and the training part of optometrist, and how do we optometrists and ophthalmologists work in association together. We would like to touch upon all these points today. Madam, based on your experience training these optometry and teaching these optometry students, whenever somebody wants to join optometry, they have two choices. One is a diploma in optometry, or there are even vision technician. There are institutions which are offering these courses of shorter duration, and there is a BSc Optometry which is 4 years. Now it's going to be 5. What should a student take based on your experience? Should they go for diploma or should they go for a bachelor's?
Sir, undoubtedly, I think the students should opt for a bachelor's degree because even if you look at the medical universities after 2020, the medical universities have also started phasing out the diploma programs. Even though the vision technicians and diploma holders, all of them have been brought under the ambit of the NCHB Act, still I would say a student today wishing to have a career in optometry should only go for a bachelor's degree in optometry. There is no doubt on that.
So, okay, once somebody finishes a bachelor's degree, what are the career choices he
So
has?
today the career choices are huge. Actually, when I graduated like 33 years back, it was only work in an eye hospital or you could work in an optical store. These were the two options. But today, if you look at it, optometrists can work in public health and policy, in government sector, they can work in the corporate sector, they can work in lens manufacturing companies. There are so many, close to 1,000 colleges in India. They can also take up teaching careers after acquiring a good quality education. They can also contribute in creating future optometrists. And also there are a lot of trends in whether it is in specialty or even if you look at vision therapy, so they can have their like a independent clinic for offering vision therapy services, for offering diagnostic services. In fact, some of the optometrists have even started their own diagnostic where they take up the diagnostic cases and they offer the reports, just like it used to happen in radiology or in other fields. So there are today also behavioral optometry, sports vision. So optometrists have started becoming a part of sports vision, and soon even in driving, before issuing a driving license, there are policy level initiatives which are like working there. They will need a certificate checking vision, color vision before issuing a driving license.
So there are multiple options, career choices for optometrists available. Not only that they should be working only in eye hospitals or in optical outlets, but there are like industry, policy, like government. I can understand that the choices are more. So if at all an optometrist, when should an optometrist go for like a post graduation? Who should go for MS optometry and PhD? All those.
Yeah. So I think if an optometrist wants to opt for career in education or research, then only they should do a master's degree or PhD. Other than that, I think if they have done a 4-year program or they are going to do a 5-year program, that itself is more than sufficient for them to work in a hospital.
At working in an optometry college should consider this post graduation or PhD.
Yes.
So what about this abroad? Like many of my classmates who studied optometry are now practicing optometrists in the US. So Are those chances still available for Indian opto? Can they go abroad and work,
Y- y-
particularly in like America or Middle East and all these places?
Yeah, current scenario, they can do. It is a difficult but not an impossible task if they want to pursue higher education in the US. More opportunities are available in countries like Australia, New Zealand, even in European countries like Spain or Portugal, where they look for a lot of, research optometrists to perform, like solve problems in their departments. So that is a very upcoming field. USA also is there, but the percentage of students going is far,
Reduced.
reduced and
So
few.
somebody from India, an optometrist finishing bachelor's of 4 years or now 5 years in optometry, how do they go and get enrolled in an American college? Should they study there or is there any certification?
No, actually, they have to study very well, and that is the first basic thing. Keeping a CGPA quite high, and also they have to build a portfolio. Like for example, they have to working and presenting, like case presentation, attending a regional level conferences, presenting a paper or a poster, or having some innovative ideas, and then they can start applying to the universities, and they will be called for, and it will go through the due process. Some of them
So
might get
should they
sponsorship.
do masters in America to work in US or they can work with
No,
our bachelors?
with our bachelors, they will not be able to do. In America, though, it's you have to do the OD program.
Okay.
So after doing the OD program, you become eligible to
How
practice
many
in
years
America.
is that OD?
OD program, it's a 4-year program after graduation. So I
Okay.
don't know how much they will consider with the current bachelors in India, what level of exemption they may be able to get. That may vary between university to university. So they can check the rules of the individual university, and then
So the maximum is they have to study for another 4 years before they can practice as
another
an
2-3
optometrist.
years at least.
Minimum.
Yes,
Okay.
minimum.
So can you help optometrists who are looking at those international opportunities? For example, there are so many different rules. For somebody wants to work in Spain, what is the requirement? A bachelor's in India are recognized in Spain. What about the language requirement? So will you be able to guide aspiring optometrists if they contact you for these? Like are they through Ophthal Academy also? Is it possible to?
Definitely. See, we have not actually given much thought about it, but yes, definitely, as part of supporting our students, we will be any student coming to do internship aspires to go abroad, we will definitely be able to handhold them, and on an individual case to case basis.
Okay. Yeah, I think that is important because many of the students after finishing they lack the direction whether what they have to do. That is something.
Absolutely.
Apart from that, basically there is always, I being an ophthalmologist, there is always this concern of are optometrists going to take away my patients or what is the line? As of now in India we don't have this as much of animosity or this thing between ophthalmologists and optometrists, but how do we balance this, like because there is very clear cut, I think in India it's very clear cut that an optometrist cannot do any treatment or any procedure. Like you can maybe diagnose a foreign body, but a foreign body needs to be removed by an ophthalmologist. You can, that is very clear. So how do we strike that balance?
Yeah, as in India, we have very clear cut guidelines. So I think it's high time ophthalmologists and optometrists have to coexist together, because end of the day, both of them are working for the welfare of the patient. So the patient does not know whether you are an ophthalmologist or optometrist. For them, they need treatment for the problem they have come. So I think optometrists should work more and more on the functional aspects of vision. So leaving the ophthalmologist to take care of the structural aspects of eye. Treatment
the
and
procedures.
medical procedures, surgical procedures, laser procedures, that can be dealt by the ophthalmologist. There are a lot of areas where an optometrist can contribute to a eye care practice, like what we mentioned already earlier, by doing a comprehensive eye examination. So a comprehensive eye examination itself takes about 30-35 minutes on an average. So an ophthalmologist does not have so much of time. So even doing that and diagnosing the condition properly in itself is a very important thing, I would say. And plus they can also contribute in fitting contact lenses, low vision devices, dispensing optics, where they can dispensing spectacles. Many of the optometry students think that dispensing spectacles is somewhat beneath their dignity. It is not so. They can also play an important role, not only to give a good prescription, but also the perfect way to dispense the spectacle is also an important aspect of giving a prescription. So these are the areas where optometrists can contribute.
So the other biggest concern for eye hospitals, like see, we have optometrists working in our hospitals, and these optometrists, if I train them in your fellowship, say I put them in vision therapy or contact lenses, after they learn, they leave the organization. That's the biggest challenge for an eye hospital. How do you think we can address this challenge?
So yeah, it is partly true, but I would not 100% buy into this argument, because yes, that is there to some extent, but I would say even a fellow is getting trained, and if they are contributing to the practice by also contributing to the revenue, they can be like somewhat incentivized. So if you do that, then I think the optometrists also love to do their more than the money and other things. What an optometrist looks for, in my experience, is always the job satisfaction and how much he or she is able to contribute to the patient. So if at all they want to leave, and also if we look at the gender ratio, optometry is one profession where about 70% women. So it is also expected that they will move to the next station, you know, so they may not be able to continue with their jobs. In which case, I think there will be other people who will continue to contribute and continue to work.
Basically, the risk of not training them because of the fear that they leave is more than they leaving. I think that is what is important. Because if you train them, you give them better recognition, promote them as a senior optometrist, make them earn better from the revenue.
And many of the optometrists are also keep an interest. I know many optometrists who come and tell me, almost every day 1 or 2 people contact me and say, ma'am, if there is any teaching opportunity, please give. So if a senior optometrist, say for 5-6 years, if someone has worked, they can also be given some opportunity to train the juniors, either by way of training or taking classes, you know. So these are the meaningful ways where they would love to contribute and be a part of the ecosystem.
I think as doctors, we should overcome the fear that, oh, if I train somebody, he might leave, because that is a very basic, it's not having any substance at all. Because as I said, the fear of not training them or the risk of not training them should be more than the fear of they leaving.
And moreover, once they are trained better, they are only going to put their expertise and efforts into the practice. So always the benefit is more.
Correct. And anyway, those who want to leave will leave. We cannot be kind of holding anybody. We cannot be forcing anybody to stay in the organization. As long as the organization grows and the person sees a growth in that organization. Because see, an optometrist who is sensible will always see that, okay, this organization is helping me train. So maybe you tell them, okay, now I have trained you in this fellowship. You stay for 2 years, I will train you in another fellowship. So those are the ways of making them, retaining them.
And moreover, once they also get trained, they also they can take up small studies. They can also, you know, create some evidence-based knowledge for the practice. They can also contribute in those ways. They can write articles, case reports, take up studies for the hospital. So the hospital stands to benefit in every way by training the optometrist.
So if somebody wants to know more information about these fellowships or the internship programs, how do they go to the website?
Yes, so they can go to the Ophthal website. Or www.ophthal.in website. So OAVS is a vertical of Ophthal, so they can have all the details. They can also reach out to us through the website or through the numbers given in the website.
So maybe you can also update on what is the initial success of the Ophthal Academy, like what are all the courses which are started, how many hospitals you are tied up, and all those things.
So Ophthal Academy was established on Vision Sciences was established on February 1st. So this is the 4th month running. So within such short span of time, we have been able to create a lot of awareness and sensitivity about our programs in the minds of students and practitioners alike. And we have had a tie-up with more than 30 hospitals. In fact, we have stopped reaching out to hospitals. Now they are reaching out to us and say that we want to be a part of OAVS and your initiatives. And also we have been meeting all these universities, meeting all the educators and HODs of various departments and telling them about our initiatives. So they are also directly or indirectly supporting their candidates. We have successfully conducted an initial webinar on beyond refraction, how to successfully build a profitable optometry practice. And another webinar we did on the optical dispensing, and a third webinar on the fellowship in orthoptics and vision therapy.
How to set up orthoptics.
How to set up an orthoptics practice. So these were the 3 webinars, and we have launched 2 courses successfully so far. The certificate course in optical dispensing with more than 20 participants, and also the fellowship program has been started. So OAVS was started only 4 months back, but Ophthal as an institution has been in vogue for more than 20 years. So I think it's a combination of both the networking and the rapport that has been built by Ophthal, and combined with my experience in optometry and vision sciences for the last 3 decades or so, has, I think, culminated in this whole beautiful concept where we are able to offer so many good programs for the optometrists. We have done 3 webinars so far, and one was on how to build a successful optometry practice, looking beyond refraction. Other one we did on dispensing optics, and the third one was on orthoptics, how to start a successful orthoptics practice. So we have also launched 2 programs, like I said, the CCOD and FOVT. 2 more fellowships are going to come up in May itself. We will be starting the fellowship in contact lenses and the fellowship in clinical optometry, and more fellowships are also in the pipeline in the coming months.
And your internships, I think you are going to start in July.
Yes, internship we will start in July. Yes.
I think it's a fairly good progress for initial period, and I'm sure this is going to reach out to thousands of optometrists in the coming years. And thank you for all your support and hard work, because you are somebody, I'm sure, self-motivated. The biggest problem we see in people these days is to motivate them, but whenever I identify a person who is self-motivated, then my role is very limited. I'm just going to guide them, and I'm sure you will bring this Ophthal Academy into a very large institution and in the recent coming years. And with all the networks, I think so much positive response from the students. Even all our webinars were attended by hundreds
more than
of
100, yes. Minimum was more than, and many people attended through YouTube also.
And our participants for the program, like fellowships, are also from Maldives, Sri Lanka, from all over India. I think it's a huge response for this thing. And
thank you.
I'm sure the start has been good, and wishing you all the best.
Thank you, sir. Thank you for the opportunity and for the guidance.
Thank you, madam.